Twisted your knee and feeling the pain? A meniscus tear can sideline you, but don't worry. Here at Herbs and Harmony, we're diving deep into the world of knee injuries, uncovering natural remedies and effective strategies to help you bounce back. Ready to heal your knee naturally? Subscribe to Herbs and Harmony for expert advice, soothing exercises, and holistic tips for meniscus recovery. We'll guide you every step of the way, empowering you to regain your strength and mobility. Let's get you back on your feet. A meniscus tear is a common knee injury that involves damage to the wedge-shaped cartilage in the knee joint. This injury often occurs during activities that involve twisting or rotating the knee, leading to pain, swelling, and limited range of motion. Causes: trauma. Sudden twisting or rotating of the knee during activities like sports or accidents can lead to meniscus tears. Degeneration. As individuals age, the meniscus can naturally wear down, becoming more susceptible to tears, especially in those over 30. Sports injuries. High-impact sports or activities that involve pivoting and sudden stops increase the risk of meniscus tears. Lifting or twisting. Awkward movements, especially when lifting heavy objects or twisting the knee under pressure, may cause tears. Pre-existing conditions. Conditions like osteoarthritis can weaken the meniscus, making it more prone to tearing. Sign and symptoms. Pain. The pain is often localized at the site or center of the knee. It can be sharp or aching and may intensify during activities like walking, squatting, or turning. Swelling. Swelling around the knee occurs due to the accumulation of fluid in response to the injury. The knee may appear larger than usual. Stiffness. A feeling of stiffness in the knee, making it challenging to fully bend or straighten the leg. This stiffness can contribute to difficulty in performing everyday activities. Popping sensation. Some individuals may recall hearing a popping or tearing sound at the time of the injury. However, not everyone experiences this. Limited range of motion. The torn meniscus can impede the normal range of motion in the knee, causing discomfort and reduced flexibility. Locking or catching. The knee might lock or catch during movement, indicating that a piece of the torn meniscus has shifted and is interfering with joint function. Treatment. R.I.C.E. The R.I.C.E. protocol is effective for most sports-related injuries. R.I.C.E. stands for rest, ice, compression, and elevation. Rest. Adequate rest to allow the knee to heal, avoiding activities that worsen symptoms. Ice. Applying ice to the affected knee to reduce swelling and alleviate pain. Compression. Using a compression bandage to control swelling might be helpful. Elevation. Keeping the leg elevated to minimize swelling is crucial. Physical therapy. Tailored exercise programs to strengthen the muscles around the knee and improve flexibility. Range of motion exercises to enhance joint mobility. Gradual progression to more challenging exercises as the knee heals. Medications. Non-steroidal anti-inflammatory drugs such as ibuprofen to manage pain and reduce inflammation. Bracing. Wearing a knee brace for support and stability, especially if there's a risk of further injury. Injections. Corticosteroid injections into the knee joint to provide temporary relief from pain and inflammation. Surgery. For more severe tears or cases where conservative measures are ineffective. Meniscus repair. Suturing the torn edges together to promote healing. Meniscectomy. Removing the torn portion of the meniscus, particularly in cases where repair is not possible. The choice of treatment depends on factors like the type and location of the tear, the patient's age, and overall health. That's a wrap on meniscus recovery. Remember, gentle care and patience are key. Hit that subscribe button for more health and wellness tips. Thanks for watching.